To perform the oblique lumbar gap manipulation, have your patient lying on the opposite side to the joint that you want to gap. You're going to ask your patient to slide forwards until they reach your hands, which is fairly close to you, the edge of the bed. Explain at the beginning that right before the gap, I am going to roll you. You will sort of feel like you're falling off the bed, but don't worry, I won't let that happen. If at any time during the setup there is any discomfort, let me know immediately and we'll change things so that it is comfortable. At the end, I'm going to get the joint in a very tight position. I'm going to ask if it's okay. If you say yes, I'm going to give a quick thrust. If there's anything wrong, say no and we will abort. So I'm going to choose L4-5 and I'm going to flex L5-S1 and leave L4-5 in neutral. So I flex and feel L5-S1 flexing, extending, feel L4-5 flexing and extending, and then I'm going to have L5-S1 flex, but L4-5 neutral. Please take your top knee and push into my belly. This stabilizes the lumbar spine. Extend the bottom leg, recheck that 5-S1 is still flexed and 4-5 is still in neutral. Place the top leg, offset with the other leg. Continue to palpate your target joint, L4-5, and I'm going to use an extension lock. So hand going up on the rib cage, opposite hand being pulled as if this were the Statue of Liberty until I feel those top joints up to and including L3-4 moving into extension, side bending, and rotation lock. Then I'm going to put my thumb on the top of L4. This is where the roll is going to occur. Do you mind if I expose a little bit of skin on the buttock? That way I'm going to have much better knot slippage. I'm going to roll her like a log. The entire body's rolling towards the floor. When I feel I've rolled far enough, I'm going to have the top part with my body lean back on the thorax as counterforce. My thrusting force will be downhill along the line of the femur. Roll, push back on the thorax. Is that okay?
Yes.
And a quick thrust. And then unroll. And that's how you perform the lumbar oblique gap manipulation.